guys, Assalamualaikum. Welcome to my vlog. This is me, Siti Nur Syuhada Raihani binti Yusuf. My number metric BP22110034. And today, I'm gonna share about mild and moderate depression. Have you ever heard about this? If not, let's go to talk about this. Okay. Mild and moderate depression. Mild and moderate depression is a disorder of a person's feeling that causes a person to feel sad for a long time. It lasts for at least 2 weeks. This disease can be suffered by anyone regardless of age, gender, or race. It may be categorized as a less serious disease in comparison with clinical depression, which is much more dangerous, but still dangerous. And now, let's move to another part to know more about the sign of mild and moderate depression. Let's go.
Here are 4 signs of mild and moderate depression. Number 1 is you have lost interest in everything. According to the American Psychological Association, a markedly diminished interest of pleasure in activities is one of the hallmarks of a depressive episode. So, if you have found that your laziness has made you lose motivation and interest in everything, including school and work, then that's a sure sign that something is seriously wrong with your mental health. With depression, you tend to lose interest in your hobbies and emotionally withdraw from those around you. You prefer to stay at home and lay in bed doing nothing most of the day because you just can't find it in yourself to care enough about much of anything anymore. Number 2, you overthink. It doesn't matter if a situation is big or small, you will find yourself overthinking it and eventually breaking down. Number 3 is sadness. It's normal to feel sad from time to time. But if you are sad or numb most of the time, even while participating in fun activities, you may be suffering from high-functioning depression. Number 4 is unhealthy sleeping pattern. Do you ever had trouble sleeping? Maybe you were tossing and turning because you were nervous about a job interview in the morning. Many people with depression struggle with this every night. Depression is sometimes linked to other struggles such as insomnia and anxiety, both of which make sleeping even harder. On the other hand, someone with depression could also sleep too much as well, since they may see it as an escape from their daily struggle. Either way, having a healthy sleeping pattern is important for your mind and body, and without one, you are more likely to feel exhausted, irritable, and stressed.
I hope this video helped you learn about some of the signs of mild and moderate depression. Could you relate to any of the signs in the video? If you can relate, remember that you are not alone. Then, please like and share this video if it helped you and you think it could help someone else too. And last but not least, thank you for watching. Bye guys!
Assalamualaikum and hello everyone, my name is Nabila binti Samsudin. So today I will bring my vlog is about the cause of dysthymia depression. See you in the next video. Did you all know what is a dysthymia? Let me share what is a definition of dysthymia. Dysthymia is a mild but long-lasting form of depression. Dysthymia, also called perceptive depressive disorder. People with this condition may also have bouts of major depression at times. Depression is a mood disorder that involves your body, mood, and thoughts. It affects the way you eat and sleep, think about things, and feel about yourself. Other than that, a perceptive depressive disorder is characterized by a continued feeling of hopelessness and sadness. This feeling may make you lose interest in normal daily activity, feel inadequate, lack productive, and have an overall feeling of low self-esteem. A perceptive depressive disorder may significantly interfere with your daily activity, relationship, work, and school. This depressed disorder occurs more often in girls than in boys. The exact cause of dysthymia or perceptive depression disorder is not known, as with major depression, it may involve more than one cause. The first one is a life event, and the second is a brain chemistry, and the lastly is inherited trait. Depression can occur due to life events. As with major depression, traumatic events such as the loss of a loved one, financial problem, or a high level of stress can trigger perceptive depression disorder in some people. Next, due to brain chemistry. Neurotransmitter, a naturally occurring brain chemical. Research indicates that changing a neurotransmitter may play a large part in depression and its treatment. Finally, depression can also occur due to inherited trait. Perceptive depressive disorder appear to be more common in people who blood related also have the condition. Researchers are trying to find genes that may be involved in causing depression. In conclusion, we must avoid from the cause that can make us depression. That's all from me. Assalamualaikum and bye everyone.
Hi guys, welcome to my vlog. My name is Anishatul. My vlog is about treatment for severe depressed person. Bye!
Severe depression. Did you know what is severe depression? Let me share about that. Severe depression is often characterized by symptoms of hopelessness, increased irritability, loss of pressure, trouble concentrating, of sleeping, or thought of death or suicide. Additionally, depression severity can change over time, growing increasingly worse or alternating between mild and severe during the same depression people.
Me again, today I want to share with you guys there are ways to overcome severe depression. The person need to get therapy with psychotherapy to help ease depressive disorder symptom. There are three of therapy that people can get from psychotherapy, which is number 1, cognitive behavioral therapy, and number 2, psychodynamic therapy, and number 3 is interpersonal therapy. That's all. See you in next video.
Secondly, medication. Medication is frequently prescribed to treat severe depression. The most common type of medication used by hospital is antidepressants. Thirdly, inpatient depression treatment. Getting depression treatment as an inpatient also allow doctor to keep you safe as they closely
Last but
monitor.
not least, complementary treatment, which is massage and yoga. This way can help to relieve depression person.
But did you know that some students in university also suffer from depression that can harm themselves? So we need to know how to overcome this depression before it gets worse.
In conclusion, treatment is very important for people who are suffering from depression to make them live happily. That's all from me. Thank you.
Assalamualaikum. My name is Eza Siti Khadidah. My metric number is BP22110244. My topic is about bipolar disorder. It is a mental condition that has an impact on your mood. Bipolar 1. People who have BP1 experience mania, depression, and normal mood swing. However, not everyone with BP1 suffer from depressive symptoms. Sometimes they just have mood swings between normal and manic. They frequently have the sensation of being on a roller coaster. You're climbing your first hill and your adrenaline is pumping. When you reach the peak, you feel as if you are on the top of the world. But what exactly is mania? Mania is defined as a distinct period of abnormally and persistently elevated, expansive or irritable mood, as well as abnormally and persistently goal-directed behavior or energy. This is only a broad definition. Not everyone experiences mania in the same way. If you have BP1 disorder and are having a manic episode, you may have a lot of energy, feel wired, having racing thoughts, talk faster than usual, engage in risky behavior without thinking, or have heightened intense centers such as smell or touch. A person who does not have BP1 may experience these symptoms for a variety of reasons. Maybe you ate too much caffeine or sugar, or you're just in a good mood. The main difference is that manic episodes are typically very extreme and out of the ordinary for the person experiencing them, and they last at least 7 days. Some people with BP1 may experience psychosis during a manic episode. Psychosis is easily defined as a loss of contact with reality. Depression is another extreme mood that a person with BP1 may experience, and it frequently occurs right after a manic episode. What goes up must come down, just like the roller coaster example when we use for mania. A person suffering from BP1 will quickly go from feeling on the top of the world to speeding down the hill and into a much more negative mood. Depressive episodes like mania do not affect everyone in the same way. When you are depressed, you may experience mental and behavioral symptoms such as having little or no interest in doing things you normally enjoy. Depressive episodes can also have physical consequences, such as making it difficult to follow or stay asleep, feeling tired, or losing appetite.
Hello, I'm Nur Aslina binti Daud. So my metric number is BB22110048. So yeah, before I start my present, so let me find someone random to ask about my topic. Hello. Sorry for disturb you. Are you busy?
No.
Can I ask you something? Okay, so I want to ask you, what do you know about depression that you know?
So I think depression is a very misunderstood disorder. People will tend to stereotype depression and make it seem as though you are typically sad all the time.
So
So that's all from me.
thank you. Alright, so depression has sub-disorder that will have different symptoms, intensity and causes. So there are many types of depression. So the type that I will present later is about major depressive disorder. Major depressive disorder can also be known as clinical depression. So those with this disorder may have an episode for longer period of time, while others may have only had an episode once in their life. People with MDD have the following symptoms for nearly a 2-week span, and it will usually arise every day. Okay, next I will tell about symptoms of major depressive disorder. Feeling hopeless, sad or numb, decreased motivation for things that they used to like, increased or decreased appetite, which could lead to weight gain or loss, changing in sleep, fatigue, not being able to concentrate, forgetfulness, death, suicide attempts, and harming yourself. MDD can be mixed with different disorders like anxiety, melancholic failure, catatonia, periparsal onset, psychotic failure, and seasonal patterns. Most people use drug or substance to feel better and will usually not notice the symptoms they have for substance medication and use depressive disorder. Okay guys, so that's all from me. So I hope you guys can learn something through my video. So thank you and bye bye.